Hi, I'm Victoria, co-host of Metabolic Health Summit. And today I'm sitting down with a very special person who not only is a speaker at Metabolic Health Summit 2022, actually coming back as a speaker, he was there in 2020, but he's also going to be covering all of the sort of behind the scenes action on our social media channels. His name is Dr. Bret Scher, and he's actually a board certified cardiologist and lipidologist based out in San Diego, California. In addition to that, he is really helping reframe the message of health and prevention as the medical director of dietdoctor.com. Diet Doctor is actually our official platinum partner and host of all of our live coverage that's going to be going on throughout Metabolic Health Summit 2022. So you can actually catch all of the behind the scenes action, interviews with speakers, sponsors, other thought leaders in the space on our Facebook and Instagram and on Diet Doctor's YouTube. So you'll definitely want to make sure you stay tuned for that. And we couldn't be more thrilled to have them as part of MHS because we really share a lot of synergy in our missions to essentially bridge the gap between science and society. So it's my absolute pleasure today to introduce you to Dr. Bret Scher. Dr. Bret Scher, thank you so much for joining me today. It's such an honor to have you back as a speaker and also hosting our live coverage as part of Diet Doctor's platinum partnership with us. We're thrilled to have you as a speaker, as well as there personally representing in so many ways this year. So thanks for joining us.
Yeah, thank you so much, Victoria. And I'm equally as excited. I mean, I remember when we first had these discussions about having sort of a deeper relationship at Metabolic Health Summit. And it was just such an easy decision because it's such a wonderful conference. And I really, really respect you and all your colleagues putting on this conference and what a high level it is. So I'm thrilled to be part of it and help however I can. So thank you.
Well, that's awesome. And that means a lot coming from you. You've last year, or I say last year, and it was like 2 years ago, which is hard to believe how much time has passed. We'll kind of get into a little bit about what you talked about. But I first kind of want to start this interview with talking about how it all started for you. You know, you're a preventative cardiologist. Your goal is to prevent heart disease, among other things, but you kind of took a bit of a different path, you know, especially compared to your colleagues when you kind of made the shift into the ketogenic diet space. I mean, you know, traditionally it's more of the Ornish style program that a lot of your cardiologists follow. So talk a little bit about why you decided to kind of make that leap in light of disease prevention.
Yeah, I mean, I couldn't have started any further from where I am now because I started in one of those Ornish style programs. I was trained in a preventive cardiology program that strongly believed in low-fat vegan diets were the way. And, you know, as part of an overall program that reduced smoking and increased exercise and focused on stress reduction and building communities and all those other wonderful things. So yeah, I couldn't have started much further. And then, you know, then you get out into the real world, the quote unquote real world, and start treating people. And it was just frustrating how I wasn't having the impact I thought I was going to have. And time again, I was writing in the chart, you know, either lifestyle modifications didn't work or patient couldn't comply with the diet, and trying to help them as best I could. And I was just getting frustrated. And so I started a small like boutique wellness center with a friend of mine who is this amazing health coach. And I thought the answer was just going to be more time, just spending more time with the patients. And fortunately, he was very well versed in ketogenic diets. And not that we started off treating people with keto diets, but on a couple of our challenging patients, he said to me, hey, how about we try a keto diet in this guy and see how it works? And at first I was like blown away. I'm like, no, that goes against everything I was taught. What, are you crazy? Right. But luckily, you know, he sort of challenged me and he's like, well, have you looked into it? Have you researched it? And so I started reading as much as I could, as much as I could get my hands on. And then it just kind of opened my eyes to this whole world that existed. And I actually got a little like frustrated and angry at the medical community and the cardiology world for really promoting one diet as the only true path to health when there was actually evidence on the exact opposite diet, you could say, still promoting health, especially from a metabolic standpoint. And the importance of metabolic health was really underlooked when I was being trained. Now it's getting a little more attention. So what I said at first was, okay, I got to try this on myself. And so I tried eating low carb and eating keto, and it was kind of revolutionary for me. And so then we started on our patients and I started seeing the effects, and that just started me down this path. So since then, I have seen no lifestyle intervention that's as effective as the low carb or keto diet for improving metabolic health. And metabolic health is crucial for cardiac health. So it's all related. Now, I wouldn't pretend to say it's the one diet for everybody and it's the only diet that works, but to not even have it as an option for so many doctors because of the way they've been trained and because of this bias against fat and the bias against animal products, which is just so misplaced. That's what frustrates me now, that it's not even an option. So my message now is that it has to be an option for everybody. It may not be the right option for everybody, but it has to at least be in the doctor's toolkit to think about for every patient, because metabolic health, weight loss are so important. Yeah, so that's how I got here.
Yeah, no, and I can only imagine like the roller coaster of emotion of like going through med school and sort of what you learn there, and you know, the nutrition, that training that you do have in there. It's just completely the opposite to where you are now, and just taking that fire and turning it into something good, and looking at how many lives you're impacting now is just nothing short of inspiring, what you've been able to do. And now with what you're doing even further, and being this just incredible voice for Diet Doctor, it's really been nothing short of amazing. So so you talk a little bit about, just now, you just mentioned it, how we kind of have to stop looking at metabolic health sort of separate from cardiovascular health. And actually at our 2020 conference, you really dived into how we're so hyper focused on individual health issues and individual markers. It's kind of like we can't see the forest through the trees, right? We're so focused on this like one single branch being LDL as sort of like a marker, that we're not seeing all these other sort of this risk forest, if you will. So in your opinion, what's wrong with sort of that approach in terms of, you know, what's the potential issues around looking at cardiovascular health in that way? And how do we promote metabolic health as sort of this synergistic thing with cardiovascular health at the same time?
Such a great point, and a really good analogy too, which I think is so true. Yeah, you know, it's the pessimist, you know, would say it's all pharma driven, right? It's all big pharma driven. We've got drugs for LDL, therefore we promote LDL. And, you know, that's one version of it. But whatever the reason is, the teaching has clearly become that LDL is the most important factor. And the default in a 5-minute office visit then becomes, here's your statin for your LDL, see you later, with not much more of a discussion. And that's not necessarily a fault of the doctors, that's a fault of the system, I think. So we have to really reform the system. But a big part of that reform is saying, well, hang on a second. The entire cholesterol profile is one part of cardiovascular risk. The other parts are metabolic health being a big one, because blood pressure is part of metabolic health. Blood sugar is part of metabolic health. Insulin, abdominal obesity, visceral fat, that's all part of metabolic health. And that's not treated with a statin. That's not treated by lowering LDL. And no doctor would ever say, all we have to do is lower LDL and then they can do whatever they want. But that's in fact what the message is when that's all you're focusing on. And that's the problem. Like, those words don't come out of their mouth, but that doesn't matter, because that's what the patient sees. That's what the patient hears.
Right.
Oh, I'm on a statin, I'm good. I can eat whatever I want. I don't need to exercise. And, you know, all these other things don't matter as much. That's exactly what they hear. And so we have to undo all of that and say, no. Cardiovascular risk is this wide ranging field that encompasses all these things. And there was a great study published, I guess it was probably, I don't know, my dates are bad, but maybe around 2020, that looked at the risk factors for developing cardiovascular risk, you know, like 20 years down the road. And LDL was on there. You know, it had a hazard ratio of like 1.3, and ApoB was better at 1.8. But then measures of insulin resistance were up around 6, and type 2 diabetes was up around 10. And they had such a much more dramatic impact on the cardiovascular risk. If that doesn't open your eyes to metabolic health being so important for cardiac risk, I don't know what does. So it really does have to be this whole package. And that's a big part of my message. And that's why lifestyle interventions come first before medications, because lifestyle interventions can treat everything under that umbrella, whereas a medication is likely only going to treat one of those things, possibly with side effects worsening the others, right? If you take a medication that then makes you ache a little bit, so you exercise less, or you take a medication that raises your blood sugar a little bit, but at the cost of lowering your LDL, like, those are trade-offs. You don't need necessarily those trade-offs when it comes to lifestyle.
Right.
So that's how I think we need to start thinking about it.
Yeah, no, it's a really great point. It's so interesting how we're so sort of hyper focused right now, and it's going to take like such a massive collective effort. But I'd love to know from your perspective, what are some of the barriers you've faced thus far, and what do we have to do to get to that next place where really we're communicating differently to patients, that it's inclusive of this like whole person, whole metabolic health view, and lifestyle is a part of that conversation. How do we get there, and what are some of the barriers you've faced so far?
Yeah, that's a great question. I mean, the biggest barrier so far is just the way our medical system is set up, that there are short office visits where you don't have time to really go into detail about all this. And that it's the incentive is to hit targets, to hit number targets with lab values, or with medication prescriptions. That those are incentives, financial incentives for the group and for the physician. And that's, I think, misguided too, because that doesn't look at the whole picture. So I think those are some of the challenges for sure. And what do we need to do to undo that is a really big question.
I know it's a loaded one.
Yeah, but I think what we need to do is really just keep spreading the message. And that's what, a big part of what I'm trying to do at Diet Doctor. In my practice, I can see one patient and help one patient. But at Diet Doctor, we can get the message out there to millions of people. And that's what we're trying to promote: healthy weight loss, improving metabolic health, factoring all your risk factors in terms of improving your health, not focusing on one thing, but really trying to find a lifestyle that works for you to improve everything. So just trying to promote that message as much as possible, having CME conferences, having conferences like the Metabolic Health Summit, just trying to reach as many physicians as possible. We've got our DD Pro program, which is geared towards clinicians, to engage clinicians so they can engage their clients through our platform and use our resources. We've got a coaching program coming out. So really just more and more trying to train professionals, whether it's physicians or coaches or nurse practitioners or dietitians or nutritionists or personal trainers, everybody. I mean, the message can come from everybody. It doesn't have to be from a doctor, but it'll be so good if this groundswell works with all the allied professionals, and then it goes to the physicians as well, that people start realizing how important this is and teaching it to their patients.
Absolutely. It's really got to come from, it's kind of like this both sides of the equation, right? You've got like the healthcare providers and really providing the continuing medical education there, but you've also, you're right now empowering the patient also goes a long way as well. So it's been really interesting to see how this is going to take a massive collective effort to get where we want to go with this. But it's so exciting to see where ketogenic metabolic therapy is going. I mean, what kind of role do you see that playing in, beyond just like what we're talking about with, maybe specific to heart disease, or, cholesterol numbers and whatnot, but, you're starting to see this expand into areas of like heart failure, arrhythmias, all kinds of stuff. Do you want to talk a little bit about what we're seeing in some of those areas as this continues to expand as a field as a whole?
Yeah, it's really interesting because when it comes to metabolic health and you're talking about healthy weight loss and improving metabolic health, a lot of it has to do with the reduction of carbohydrates. Like that's the key, is reducing the carbohydrates. But then you have this other end of the spectrum where ketones themselves actually have some pretty amazing potential functions. And that's where things like heart failure therapy, by having ketones, by elevating ketones and having someone on a ketogenic diet, allowing the heart to use ketones as fuel, and the natural diuretic effect that can happen with ketosis, like that could be potentially a beneficial treatment for heart failure. And of course, we need studies to evaluate that more deeply, but the theory, the mechanism is there, with some, very early anecdotal experience, clinical experience suggesting it could be helpful. So I'm really excited about that. And the same can be said for, cancer therapy and mental health therapy, and so many different areas where the value of ketones can be so beneficial. And I mean, we're having so much research coming out now, whereas 10 years ago, I don't think we could really say that. There wasn't, if you were researching this 10 years ago, you were sort of like the oddball going off on your own, not getting much support. Now there's support. Now there's foundations trying to fund some of this research. And so I'm really excited about what the future holds for ketogenic therapy for different medical conditions. Yeah.
Yeah, it's really exploding. I mean, even with, in the midst of a pandemic, it's just been amazing to see it continue to pile up. And so we've got a lot to talk about, certainly at Metabolic Health Summit 2022. But speaking of MHS, let's talk a little bit about what you're going to dive into, because it's really interesting and it's definitely a hot topic, sort of elevated LDL amongst low carbers, right? There's this, group of hyper responders, if you will, that's certainly, there's a lot of debate swirling around about it and whatnot. I happen to be one of those people that had, my LDL shot up and then sort of my body found homeostasis. So I'd love to hear, maybe give us a little bit of a glimpse of what you're going to kind of dive into at MHS.
Yeah, well, I mentioned before how it doesn't have to be necessarily this trade-off of taking a drug to lower your LDL that worsens your metabolic health, but instead you can have a lifestyle to kind of improve everything. Well, the one downside to low carb and keto diets that may be that trade-off is the rise in LDL, because everything else seems to improve. Blood sugar improves, insulin improves. Most people lose weight in a healthy way. Triglycerides improve, HDL improves, but what happens when the LDL goes up? And first and foremost, the way I start every talk is to say, look, in the majority of people enrolled in trials for type 2 diabetes or for weight loss, LDL does not go up in the majority of them. It is a small percentage. Then when you look at people who are using a ketogenic diet for other means, like in the study by Steve Finney on the endurance athletes who were following a ketogenic diet, there were 10 of them, and all 10 of them were hyper responders, right? So that type of population, the work done by Dave Feldman with their recent publication showing these lean mass hyper responders are more likely to have a rise in LDL. So now we've I think the field has done a good job of identifying who's more likely to see this rise. Right. And the key being, it's not the person with type 2 diabetes or the person trying to lose weight. But then the question is, okay, well, now what do we do about it? Now it's the harder question. That's the really harder question. But again, that's when it comes down to seeing things under a whole umbrella in terms of what is your risk, and not just looking at the one factor. Because say someone does start a ketogenic diet and they reverse their type 2 diabetes and they lose their visceral fat and their blood pressure normalizes and their insulin levels go down, but their LDL goes up a little or modestly or whatever you want to say. Well, okay, then you have to balance those things out, right? But what if it goes up a ton? Or what if the LDL goes up to 300, 400? Okay, now that maybe is tipping the scale another way. And we're sort of getting out into this area where there isn't research on this one specific population. So you can react to it in sort of two different ways. You can say, well, there's no evidence that this is as harmful in this population as it is in other populations. So let's monitor it, let's follow it, and let's not get too excited about treating it. Or you say, well, look, we don't have evidence in this population, so we should probably default to the evidence we have, assume it's concerning, and treat it accordingly. There's no fault in either one of those approaches. That's a discussion between the physician and the patient and trying to figure out what's right for that individual, knowing that there is a lack of specific evidence in that area. So what I hate is when people get very judgmental about it and be like, how could you treat your LDL? Don't you know that it's not a concern? There's no evidence. Or, how can you let your LDL go up? Don't you know that it's dangerous and kills you? And people just get so polarized rather than seeing, okay, look, this is a specific area and there are things to consider and there are other tests you can do. And so that's a lot of what I'm going to discuss this year at Metabolic Health Summit, sort of the mentality that I think we need as clinicians and as patients as we're going through this process. What are the factors we need to weigh to help us make the right decisions for us as individual patients or decisions for us as clinicians so that we feel we're doing the best thing possible for our patients. And it's so much easier when you say, here's the one study that looked at this exact area and this is exactly what it showed. It's not that clear, right? So instead we have to pull from what exists and really sort of change or refine our thought process.
Right. Yeah, it couldn't be more true. It's like, you're looking for that one study, but people are also looking for that one solution when lifestyle and there's so many factors at play here, right? So it's not a super simple approach, I think, overall to figuring this out. So I'm really excited to kind of hear what you have to say and diving into that topic specifically, because you're right. There are these two sides that it's been fascinating to watch. So we certainly have to continue to lead with the evidence and allow for that to lead the way. But having people such as yourself, who's got, the experience with the patients within cardiology, is just going to be priceless for our attendees. So we're really excited for that. let's talk a little bit about the future of Diet Doctor, because you guys have just changed the game and really put low carb ketogenic nutrition on the map and really made it doable for people. You've inspired people along the way. You guys are really innovators in this space. And we couldn't be more excited to be partnered, because we align so deeply on so many levels in terms of like where we want to go in this entire field and movement, right? So I'd love for you to share as much as you can as the medical director at Diet Doctor. What's next for you guys? I know you've got like this focus on healthcare practitioners as well as lay public, but what's next for you guys in terms of sort of big picture?
Yeah. Thanks for the question. And we've got a lot on our plate that the goal at Diet Doctor is really just to reach as many people as possible and help them improve their health in any way possible. And I think we've done a great job in promoting a ketogenic diet for exactly that purpose. And so we're trying to reach not just the individual, but the clinicians, as many clinicians as possible, to help coaches learn how to coach, specifically in a low carb setting, to help doctors get CME and learn how to take care of their patients. So I think we're doing a really good job with that. And that's one area where we're really progressing. Another area is actually just helping people figure out ways to sort of troubleshoot when things aren't going perfectly. I mean, we've got to be honest, ketogenic diets can be so powerful, but they're not necessarily the magic bullet for everybody. Some people aren't going to respond as they would hoped or as other people do. And there the key is, okay, well, what's going on and how do you adjust it? And there we're trying to build in more sort of like personalized interactions with our app to say, okay, here's ways you can tweak it if X, Y, and Z is happening and you're not progressing in the ways you want to see. Here are ways you can tweak it. And it's really interesting, because then you get the science, you get the clinical experience, and you get the technology. So trying to bring all that together to find the product that's going to help the person the most. So whether that's, edging them towards a higher satiety per calorie type of meal plan, so they're if hunger is an issue, or maybe they are overdoing the fat bombs or overdoing the butter in the coffee, which can definitely serve a role in the beginning. But then after a while on a keto diet, if weight loss and metabolic health are your focus, then maybe it actually starts to sabotage things after a while. So knowing when to back off on that. And there's no one prescription. So it's trying to help people navigate this journey as best they can, and as best they can for them as an individual. So that's sort of the excitement, and it's going to be a continual process. But I really love that intersection of clinical experience, what the scientific evidence says, and the technology to reach the individual. So yeah, I'm pretty excited about what we have coming up in the future.
Yeah, we can't wait to follow along with all of it. I don't know, you guys are such a mighty team over there, getting just what you've been able to achieve with it so far. And I couldn't be in more alignment with you on the technology front too. So I think that's a really interesting area, that pulling that piece in is going to be pretty fascinating, and I think pretty critical in furthering this along as well. So you'll definitely have to keep all of us updated on what's happening, and tell everybody where they can find you as well as Diet Doctor. Where would you like to direct people in terms of resources and all of that?
Yeah, thanks. I mean, the best place to start is just dietdoctor.com. That's where you can kind of direct yourself to everywhere.
Right.
A lot of my stuff is also on YouTube. We have the DD News on YouTube, and then all the podcasts are on YouTube. And you can also find the podcast on any of your regular podcast sources. So, I mean, those are sort of the best places to start. I do see patients in a virtual practice, lowcarbcardiologist.com, to find out more information about that. But all my content and all the information where I'm trying to reach as many people as possible, that's all directed towards Diet Doctor now. And we're also active on Twitter, as is Dr. Andreas Einfeld. He's on Twitter as well. So those are great places to connect with us. Lots of areas. We're trying to reach as many people as possible in as many venues as possible.
Yeah, you guys are all over the place. It's awesome. And for MHS 2022, you're going to be our official live coverage host. So you'll be able to find, for those of you watching, you'll be able to watch Dr. Scher interview a variety of our speakers, thought leaders, as well as speaking. He's going to be quite busy at MHS, but you'll be able to catch that on our Facebook, Instagram, and on Diet Doctor's YouTube channel, which is going to be really amazing. So thank you guys so much for your partnership. Thank you for your important work in this space, Dr. Scher. Like, you really are changing the game when it comes to pushing this movement forward in such a big way. So I can't thank you enough personally for everything that you do.
It's very kind. Thank you so much. And I'm really looking forward to seeing you at Metabolic Health Summit and having the opportunity to interview all these amazing speakers you have. I mean, I'm just super excited for the opportunity to have an excuse to sit down and chat with all these people for 20, 30 minutes and just, force them to sit down and talk to me and pick their brain and learn from them. This is going to be awesome. I can't wait.
Yeah, we're excited. It's going to be great bringing everybody back together again, seeing you guys in person. And thank you again. And thank you all for watching today. If you want to check out more, go to dietdoctor.com to check out all of what Dr. Scher is doing and all the great people over there at Diet Doctor. And Dr. Scher, I'll be seeing you soon in May. Thank you so much for hopping on, and we'll see you soon.
See you soon. Thanks.
All right. Bye.